जी
हमारा पिक संभाल के रखा है परदेसी सर टोपी वाला.
Topi is famous in Maharashtra.
The Patni topi I'm talking about, the Patni jacket and that topi, Patni topi.
Holika. So in rituals, we wear topis, actually. Even in marriage functions, Deepavali, and all that.
सर हेलो सर.
हाँ हाँ.
माधुरी मैम का नंबर एक बार फॉरवर्ड करो.
अरे मैंने उनको मेल पे किया है.
हेलो निभा. You're muted, Niba.
निभा दी म्यूट पर है.
Good evening, sir.
Good evening.
Good evening, Bhaskar sir. Good evening, Dr. Rekha, Dr. Archana, Madan.
Good evening, Niba ma'am, Rekha ma'am.
Namaste, namaste all. So nice to see all of you in one platform. Very nice.
Parag sir is also there.
Yes, Parag sir is also there.
He is
Good evening,
traveling.
Parag sir.
Good evening,
Rajendra sir.
Parag, I think, is having a holiday.
Hello, good evening, Dr. Niba.
Good evening, sir. Pranam, sir.
Many office bearers have joined from societies. Madhur ma'am will join in 1 or 2 minutes. We can start.
Yeah.
झाले सगळे जॉईन झालेत, फक्त माधुरी मॅडम राहिल्यात.
हा, नवीन लिंकने पण जॉईन होता येईना त्यांना, जरा प्रॉब्लेम येतोय.
Bhaskar sir, namaste.
Namaste. You left and you joined again.
No, I joined through mobile because the link was not connecting. Then I joined through laptop and then left the mobile. Wanted to be on time, so I joined through mobile first.
Right.
Dr. Shilpa ma'am, Dr. Suhasini ma'am, can I request you to make your video on? Everyone can see. Yeah, actually, these are the presidents and secretaries of society.
Thank you.
Dr. Suhasini Bopri ma'am is president of Pusat Society. Shilpa ma'am is secretary of Sevagram Society. And welcome Neha madam, Neha Lad madam, who is the president of Nasik Bijua.
Good evening all.
Good evening, everyone.
Madam.
Good evening. Good evening. Nice meeting Dr. Shilpa, Dr. Suhasini.
This time,
Namaste.
purposefully, I have selected small societies of Vidarbha. That actually I had not covered in the predecessor's tenure, that societies.
Neha Lad madam, Shilpa madam, and Suhasini madam. I'm Rekha Rajendra Kumar from Bangalore. I'm the past president of Bangalore Society, contesting for medical disorders in pregnancy. Sorry to bother you, but I'm requesting you to vote for me, please. All three madams.
And there is another request from Dr. Nibha Mohan also. This is for Chairperson Breast and Puerperal Health Committee. So please support, seeking support, and wish that you all support us. Thank you. Thank you, everyone.
Best wishes, Dr. Rekha, Dr. Nibha.
Thank you, sir. We
Best
definitely
wishes.
need your blessings.
I think
Thank you.
Dr. Gita has not joined.
Dr. Pardes's blessings are most important.
No, Bhaskar da. No, Bhaskar da. Take blessings of Bhaskar da.
Yeah,
Yeah,
we
your
have
blessings are very important.
We have requested him many times and taken his blessings. Both of you.
Shall we start, sir?
Yes, we can start.
Where is Geeta?
She's also facing some issue. I have sent her the new link, but don't know.
Ah, there she is. Geeta's joined. I can see Geeta. Hi, Geeta.
Hi.
Only
Yeah.
Madhuri ma'am is.
Yeah, Dr. Geeta
Thank you,
has
sir.
joined. Hi, Dr. Geeta. Namaste. Rekha
Hi.
here.
Hello, Geeta ma'am.
Shall we start now?
Yes, please.
Yes, sir. So good evening, all the faculties and delegates for this Core Connect live webinar, which is the series which is on sexual health for all. It is 11th episode, and it is organized by AMOG Sexual Medicine Committee in association with Nashik, Hingoli, Pusat, Sevagram, and Akola Obs and Gynae Society. And it's my honor to welcome our convener, Dr. Madan Kamble. Sir is a consultant Obs and Gynae and aesthetic gynecologist and sexual health expert. And Sir is a chairperson of AMOG Sexual Medicine Committee, national coordinator of Foxy
It's okay,
Sexual
Mehul.
Health and
It's
SGI
okay.
Committee. Yeah,
It's
thank you,
okay.
sir.
Thank
Welcome.
you. Yes. Good evening, all. On behalf of AMOG's Sexual Medicine Committee, I'm very happy to welcome you all on this board for this special episode of Sexual Health for All. Since I'm running in this tenure continuously, and this is the 11th episode, specially organized with AMOG societies of Nashik, Hingoli, Pusad, Sevagram, Akola, 5 OBGY societies, with the support of Corona remedies. For this particular episode, I welcome today's chief guest, Dr. Bhaskar Pal sir, who is the president-elect of Foxy, and guest of honors, Dr. Pardeshi sir, Madhuri Patel ma'am, Dr. Parag Biniwale sir. I also welcome my co-convener, Dr. Saudamini Naik from Nashik. And today's speakers, Dr. Geeta Valsarkar madam and Dr. Archana Dvivedi ma'am, and all the chairpersons, Dr. Vasanti Lad madam, with the president of Nashik OBGY Society, Dr. Sonali Damkonwa, with the president of Hingoli OBGY Society, and Dr. Suhasini Bhokwi madam, who is the president of Pusad OBGY. Also, I welcome Dr. Nibha Mohan madam, who is the secretary of Patna OBGY Society, Dr. Rekha Rajendra Kumar from Bangalore Society, and Dr. Shilpa Raut from Sevagram Vardha OBGY Society. I welcome you all for this particular webinar. Next, Mehul, I have the CV of chief guest. Yes, we are so lucky to have our chief guest, the most dynamic and ever-loving person.
Madan,
Dr.
don't bother. Madan, please don't bother about the CV.
Okay, sir. Please, thank you for joining, sir. We are waiting for your
Sir,
blessings. Yes, thank you, sir.
Thank you.
Over to you, sir.
At the outset, I thank AMOGS and especially the Sexual Medicine Committee for honoring me with the invitation to become the chief guest for this episode. Dr. Madan Kamble has been working very, very passionately for increasing awareness for sexual medicine, not only in Maharashtra, all over the country. He's a very active member of the Foxy Sexual Medicine Committee as well. It's a pleasure to be among friends my old dear friends, Dr. Rajendra Singh Pardesi, Dr. Madhuri Patel, and Dr. Parag Biniwale. And I also take this opportunity to welcome the office bearers of Nasik, Hingoli, Pusad, Sevagram, and Akola Obs and Gynae Society. I think of all the states organizations, AMOGS is the most vibrant. And thank you, Dr. Madan and Dr. Saudamini, for calling me today. We have two excellent lectures, one on understanding sexual wellness by my dear friend, Dr. Geeta Balsarkar, and one on midlife, is it a psychosexual crisis by Dr. Archana Dwivedi. I'm sure that everybody will be very benefited from this webinar. And as you can see that this is 11th episode of the Sexual Medicine Committee of AMOGS webinars. So I congratulate and I keep up the good work. And I also take this opportunity to wish Dr. Madhuri Patel all the best for her elections for the post of President FOGSI, Dr. Geeta Balsarkar, all the best for the post of Vice President FOGSI, and also Dr. Nibha Mohan and Dr. Rekha Rajendra Kumar for their elections, which will come later for committee chairpersons. Thank you very much again for having me.
Thank you, sir. Thank you so much for your blessings and support.
Thank you, Bhaskar sir, for coming and blessing us. You are always with AMOGS, and we are eager to work under your dynamic leadership for the next year. Thank you, sir.
Thank you so much, sir, for wishing us with all your warm words. Thank you so much.
I welcome today's guest of honors, Dr. Rajendra Singh Pardesi, sir, who is the immediate past president of AMOGS. He is a very humble, kind, and lovely person.
It's okay.
He is the best person, best president of AMOGS, I think, up till now.
Yes.
I have enjoyed working under sir's guidance.
Thank you.
Welcome, sir. Welcome.
Thank you, Dr. Madan, for kind introduction. Madan has worked very hard under me for 2 years, and now also he is working as chairperson of Sexual Medicine Committee, AMOGS, and as Dr. Bhaskar Da told, he is not only working in Maharashtra, but all over India he is working, and he is passionate about the sexual awareness and sexual committee work. So, respected chief guest, Dr. Bhaskar Pal, sir, guest of honors, Dr. Madhuri Patel, Dr. Parag Biniwale, conveners, Dr. Madan Kamble, coordinator, Dr. Saudamini Naik, then Dr. Archana Dwivedi, chairperson of Midlife Management Committee, Dr. Geeta Balsarkar, our ex-editor journal. First, I wish to congratulate Dr. Madan Kamble for organizing this type of webinar on sexual health in association with Nasik, Hingoli, Pusat, Sevagram, and Akola Obijawai societies. I am feeling proud to be a part of this webinar with our AMOGS societies. So he told me, sir, our societies are there. So I told Madan, see, I am always there when our societies are involved. Dr. Madan has chosen excellent topics on sexual wellness and midlife psychosexual crisis. Dr. Geeta Balsarkar and Dr. Archana Dwivedi, they are the right persons to guide us in these topics. And with the galaxy of speakers and chairpersons, Dr. Vasanti Lad, Dr. Sonali Damkondwar, Dr. Suhasini Bhoppi, Dr. Shilpa Raut, Dr. Rekha Rajendra Kumar, Dr. Nibha Mohan, I think this is going to be a great event. I wish every success to Dr. Madhuri Patel, Dr. Geeta Balsarkar, Dr. Rekha Rajendra Kumar, Dr. Nibha Mohan for their future endeavor in FOGSI. Thank you. Thank you so much for inviting me. Jai Sri Ram.
Thank you. Jai Sri Ram.
Yeah, thank you, Pardesi, sir.
Thank you so much, sir.
Yeah, for your kind blessings. You are always very supportive. And I also wish all the contestants of the FOGSI elections, all are doing very hard work and very active and dedicated persons. I wish every success to all the contestants. Over to you, Dr. Saudamini Naik, for further proceedings.
Thank you, Dr. Madan. A very good evening to all of you and a warm welcome. It gives me immense pleasure to introduce today's guest of honor, Dr. Madhuri Patel. She is the past Secretary General of FOGSI and she's nominating the Foxy President elections this year. She's a small package with a lot of additions to her CV. I welcome you, madam. Over to you, ma'am.
Thank you, Sudhamini. Can you hear me?
Yes, ma'am.
Yeah. So I'm really first apologize that I'm traveling. My network may not be proper, but please excuse me for the same. So respected our Dr. Bhaskar Pal, he's our president-elect, Foxy, and I must thank him for his good wishes for my upcoming president election. Then Dr. Rajendra Singh Pardesi, both of them are my very good friend, and I also thank Dr. Rajendra for his good wishes and blessings. And of course, my another friend, Dr. Parag, who is also guest of honor, who is the ICOG chair. And we all three of us are, all three of us are friends since 3 decades. So we know each other in and out. And of course, what to say about Madan? Madan is a very hard-working, person. He is not only in Foxy, Amox, but he is everywhere, I will say. And first time I interacted with him when I came for his great conference in Sholapur of Amox, and it was a lovely, he had organized very well with his team. And Madan, thank you very much. And Saudamini, and of course, our co-coordinator, then Dr. Geeta, Dr. Archana, Dr. All the chairpersons who are here, they are going to really enlighten us on this sexual, wellness and, psychosexual problem in midlife, midlife age. So let me say that, when Dr. Neeraj Yadav was there in a sexual medicine committee in Foxy, he questioned me, Madam, who is going to sponsor me for this, program? So I said, Foxy will give you the platform. And can you imagine, he has done so many programs in a form of webinar that now all the gynecologists and obstetricians are aware and sensitized for this, sexual medicine across India. So it is a great part followed by Apurva, and now Madan is also following the footsteps. So I'm very happy that we have not only sensitized gynecologists across India, but also to the small place, and even the patient awareness programs are also very, very important. So I am really, congratulate them for who are also going to enlighten us on these topics. And let me tell you, when I was Secretary General of Foxy, in my 3.5 years of tenure, I must have traveled more than, 230 societies, including Nashik, Hingoli, Pushad, Sevagram, Akora, all societies travel almost societies plus out of 286 societies. And the growth of our members in Foxy about more than 8,500 during my tenure, and there was a growth of societies almost 26. And of course, we could save lots of money for
Hello. I think her bandwidth is low.
I think is traveling, so maybe.
Hello. Thankful and Madan, all the best for your future endeavor, and congratulations to all of you for the very, very, apt webinar. Thank you once again for giving me this opportunity, and thank you all of your best wishes. Thank you once again.
Thank you, madam. Thank you so much for your kind words. I would like to introduce our third guest of honor, a very humble, sweet, and handsome chairperson of ICOG, Dr. Parag Biniwale. He is another person who is academically quite active and has many packages again added to his CV. Sir, are you there?
Sir has left just now. He's busy in some important work.
Okay, shall we continue with our first session then?
Yes, thank you once again, Dr. Madhuri ma'am, for your kind words, Bhaskar sir, Pardesi sir, for accepting our invitation and blessing us. Thank you once again.
We begin with our first session. For this, I would like to invite and welcome all our chairpersons. It gives me immense pleasure to invite and welcome the president from my home ground, Dr. Vasanti Aka Neha Lad, who is a dynamic and academic president. Our second chairperson for today is Dr. Sonali Tamkondwar. She is president of the Hingoli Obstetrics and Gynec Society, a beautiful and smiling person. Our third chairperson for today is Dr. Suhasini Bopi. She is the president of Pusat Obstetric Gynec Society. She is also very dynamic and academic. Welcome all of you. I request Dr. Vasanti Lad to introduce the speaker of today. Ma'am, are you there?
She is there.
Hello.
Welcome, ma'am.
Yeah. I am audible.
Yes.
Yes. Good evening, Dr. Bhaskar Pal sir, Dr. Pardeshi sir, Dr. Parag, and Dr. Madan. Good evening to all Madhuri Patel madam, all seniors and dear colleagues. First of all, let me thank Dr. Madan for inviting me to this webinar and giving me this opportunity to be a chairperson. I think it's as Dr. Madhuri madam said, it's a little different topic, but last few years, there has been a great sensitization of the obstetrician and gynecologists regarding the sexual health. And we realize in our daily practice that especially in the infertility practice, we know that it's a very important issue and many of the people are not still aware about the basic sexual practices. So for this particular subject, we have a great academician, Dr. Geeta Balsarkar, as our speaker. I know madam because for one of my first seminars, I invited her to be a speaker and it was a very excellent oration. Everyone was very happy with her performance. And it is, thank you, but it's I feel very happy and it's my pleasure to introduce you. All of us know she is been standing for the, as a candidate for the Vice President West Zone. But more than that, she's a professor and unit head at Nauroji Wadia, which is a very esteemed institution, one of the top institutions of India. She's honorary gynecologist consultant at Tata Memorial Hospital. She's fetal medicine consultant. She's been editor-in-chief for various journals. She was a past president of, former president of Association of Medical Women in India, former president of Mumbai Menopause Society. She has received, she is a recipient of prestigious Hargobent Foundation Fellowship for Study of Fetal Medicine in London in 2008. She is undergraduate and postgraduate teacher and examiner for more than 25 years. She had edited various books and she has written chapters in various books and she has many publications under her wing. So I think she's a great academician. She's a great orator. I think all of us are going to definitely enjoy her talk and I will ask madam to proceed for her talk.
Yeah. Thank you. Can I have slide share? Can you see my slides?
Not yet.
Can you see my slides?
Not yet.
Hello?
Not yet. Not yet.
No?
No.
Okay. I'll stop share. Share.
It came and went.
Yes, it will take few seconds time. Just a hold. Yes.
Can you see now?
Yes.
Yes.
Okay. The topic that I have chosen to speak today is sexual wellness. Okay. Everybody talks about sexual health. So when we talk about sexual health, we have to start from wellness. If we can identify wellness, then we know what is illness. So kindly vote and support actions. According to WHO, sexual health is defined as a state of physical, mental, and social well-being in relation to health and sexuality. It requires positive and respectful approach to sex and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. Each of these words are very, very important. Free of coercion, discrimination, and violence. So, what is the patient presentation? How do they present to it? Dr. Kelly Jones is a gynecologist who has worked very extensively in this field, and she notes that the most frequent sexual health complaint is libido, painful sex, and difficulty achieving orgasm. They say that many of those who are perimenopause and menopausal patients, they also can complain of sexual health and function, but it's comforting to understand that majority of these experiences with which the patients come to me are entirely normal. So we as gynecologists, when a patient comes to us and gives us a complaint, they most of the time they just need reassurance. They need to be told that they are just normal and that it is not anything that is wrong or something. Patients sometimes cannot differentiate between what is normal and what is not normal. So it is our duty to educate them about what is normal. There is importance of sexual assessment in primary health care as well. It is integral to the holistic care. It decreases patients' risk for sexual dysfunction, sexually transmitted infections, and pregnancy. Often excluded are the provided and the perceived patient discomfort. It is not often that the patient is very comfortable talking to the provider about her sexual dysfunction, and the lack of clinical training on part of the provider to take adequate history from the patient. The doctor should be able to give adequate time for him to be able to elicit the training, and there is in our country, there is problem of shame. So to prevent this, what we need is a primary prevention and a preventive education, which is very, very lacking. And then secondary is the screening of these patients for STIs or their sexual problems, and tertiary is early diagnosis and treatment. So today I'm going to dwell with you about the primary, the preventive, and the educational aspect of the sexual health or the sexual wellness, how we can reassure patient that all is well with her. So there are key points to ensuring a productive sexual health conversation. How do we initiate conversation with the patient? We have to avoid moral or religious judgment of the patient's behavior, avoid terms that make assumptions about sexual behavior or orientation, and we must not ask her about how many partners or are you monogamous. We have to ensure that understanding around terminology and the pronunciation for patient concerns to avoid confusion. Like we might be meaning something, but the patient can understand something else. We have to establish rapport and consent before addressing the sensitive topic, and we have to respect the patient's right to decline answering questions. If the patient says, well, I don't want to answer this question, we have to accept it and use a sensitive tone that normalizes the topics you're discussing, and use neutral and inclusive terms to avoid assumptions about the orientation. So there are 5 P's of sexual health. So the first one is a partner, and 2 are the practices, 3 is a protection from STIs, and 4 is the past history of STIs, and 5 is a pregnancy intention. So we can start a discussion with her by starting with the pregnancy intention and then go on to the other P's. So always remember to take 5 P's of sexual health whenever you talk to your patient. So this was a study which was conducted to find out how much was their knowledge, whether their sexual information is sufficient. So 44.8% of the patients, they said yes, they got adequate information from the healthcare providers, whereas 24% said maybe he said it, maybe I didn't understand, and 31 patients just said no, we did not understand what the sexual provider was telling to say. So there are 7 dimensions of sexual wellness. 1 is biologic, 2 is sensual, 3rd is desire, 4 is the heart, 5 is the intimacy, 6 is aesthetic, and the 7th is a transpersonal. So each of this has to be explained to the patient in detail if we want to dwell upon her that sexual wellness is very, very important in her life. So there are 77 needs that are classified, and sexuality is the 6th of the 77. There are others as well, the 77 needs, but sexuality is very high on the list and is very, very important to the patients. What is the difference between gynecology and sexual health? Gynecology is a medical specialty which focuses on reproductive health throughout a woman's lifetime. Sexual health, on the other hand, is a broader concept that includes reproductive health, but also encompasses aspects of sexual well-being, which is beyond reproduction. So protection is the name of the game. So the patient has to be protected at all times from unwanted pregnancy and from the various sexually transmitted infections. So this is one particular slide. I'm sorry about the small fonts, in which how we can start talking to the patient about her history. So the 5 P's that we have to ask her about her partners, about her practices, about her past history, about her pregnancy plans, and about her pleasure. There are some pointed questions or direct questions that you can ask her to bring about this particular history there in this particular chart. Then there are a lot of sexual health assessment tools, like cultural competence is very, very important. We have to know what is the culture that the patient comes from and whether she will be happy talking to us about it. It has to be non-judgmental. It has to be in a very safe space, and we have to give enough time to the patient. So there are assessment tools. There is a path to intimacy, connection, and sexual satisfaction and love. It is called as the Pixel model. And the tools are the PLICIT, which is a particular table that is present, and there is a guide to taking a sexual history, the 5P, that is the partners, the practices, the protection from STDs, past history of STDs, and prevention of pregnancy that we have to take from the patient. One key question which is very, very important, which will lead to it, is about her future plans for a pregnancy. So that with that we can start asking the patient about her sexual health. So if you see this Pixel model, there is a very, it has got many layers. It is a path to intimacy, connection, sexual satisfaction, and to find out the history. So there is a self-care that is tension, and the 7 C's of that is communication, commitment, the calendar, her menstrual calendar, the connection, confidence, courage, and compassion, and the 7 types of intimacies, that is affection, social, physical, intellectual, romantic, emotional, and sexual. And the body connection enhancers, which is personal hygiene, the breath work, the relaxation, yoga, if she's into any yoga exercise, body mapping, and the pelvic floor health, which we can all assess of these patients, the sexual empathy and the focus. And we have to take this particular history if we are going to find out about her sexual wellness. The PLICIT model of addressing sexual functioning starts with permission. First, the patient will give you limited information on the basis of which you will give specific suggestions and then go on to make an intensive therapy. So one key question that we can always start our history of sexual health is, would you like to become pregnant in the next year or the near future? And this will have 4 response options of yes, no, unsure, or okay, either way. So from this, we can start conversing with her. So what is good for her pelvic organ? What is the important is that it supports the organs, also responsible for the arousal, erection, and orgasm, the bowel bladder function, and it is also part of the core. This is very, very important history that we have to take. There are a role of pelvic muscles in orgasm. The pubococcygeus and the iliococcygeus muscle, they are the key players, and they contract rhythmically and are increasing the depth and the intensity of the experience. So strengthening and relaxing these muscles through exercises like pelvic floor contractions, they can enhance and amplify the pleasure. Then there is bulbospongiosus muscle, which also, though in addition to other function, it has an extra dimension of ecstasy, and it's made to narrow the urethra like a sphincter and to prevent the incontinence. Then there is the ischiocavernosus muscle, and then there is a puborectalis muscle. The puborectalis muscle, we know, is primarily involved in maintaining bowel, and can also make its presence known during orgasm and can enhance pleasure and intensify overall experience. If the patient has had a vaginal delivery, sometimes the puborectalis can get damaged, and this can cause a lot of problem to the patient. The pelvic floor pain or the tightness illness if the patient has, that could be because of the visceral pain syndromes, the childbirth, biomechanical abnormalities, overuse injuries, or repetitive bladder, vaginal, or prostate infections, and the pelvic floor clenching. So this particular history is very, very important to take. We can also, there are a lot of pelvic floor pain like pelvic floor dysfunction, lichen sclerosis, lichen planus, pudendal neuralgia, vulvovaginitis, repeated urinary tract infections, and endometriosis, all of which can present with the pelvic pain. So what is interstitial cystitis? This is major player in pelvic plane, irritative bladder function. It is associated with painful sex, and the pelvic floor dysfunction like vestibulodynia, endometriosis, and gut dysbiosis are often connected. So there are also male pelvic pain, which we have to be aware and known. That is chronic non-bacterial prostatitis, hard flaccid syndrome, interstitial cystitis, painful bladder syndrome, pudendal neuralgia, and chronic pelvic pain syndrome. So this is erectile dysfunction, poor quality of erection, inability to achieve erection, inability to maintain the erection, and the decreased force or inability to ejaculate. These are all very, very sensitive history, which we have to elicit from the male partner also. So can you see this particular white discharge around in this particular picture? That is the collection that is there between the labia minora and the labia majora, and there are various variations in this particular thing. Normal is a full exposure of the clitoris, and you can see the corona. Mild adhesions is 75% of the glands is exposed, moderate is maybe 50%, and severe is less than 25%. The white discharge is often the smegma, and that tells us that she has been in sexual wellness, and that sexual intercourse has been happening. The vaginal discharge refers to clear or the vaginal fluid that exists in the women who are sexually active. These discharges are normal. However, their quantity, consistency, color, and smell alterations might indicate an infection or underlying problem. Commonly known as leukorrhea, this discharge observed occasionally on the underwear or the panty also. It removes the dead cells and bacteria. The main reason behind this is to cleanse and lubricate the vagina of the harmful bacteria, prevent the infections, and maintain the health and cleanliness of the reproductive tract. So the vaginal wetness, there is a difference between the cervical fluid, which is very little thick in consistency and can, spread from the fingers, and the arousal fluid, which is a clear, watery, odorless vaginal discharge produced by the Bartholin's glands. It appears when our body is physically aroused. There are various textures to vaginal discharge. It can be clear, which is very healthy, milky white, which is also healthy. But if chunky, it could be yeast infection. Gray is bacterial vaginosis. Bright yellow could be STI. Green is STD or bacterial vaginosis. Pink, pregnancy, injury, or the start of the period. Red, it is a period or the miscarriage. Brown, infection at the end or at the end of your period. And watery, which is ovulation or the sexual arousal. So we have seen that these various color discharges are present. So the healthy and is a white, clear, transparent infection that we have to see in this patient. So we all know the 4 stages of the sexual response: the arousal, the plateau, the orgasm, and the resolution. I'm not going into details of this, but the fact is 71% of the women are unaware that vaginal deliveries could increase the risk of sexual disorders. Up to 70% of the women experience stress urinary incontinence in the postpartum period. 36% of women have persistent diastasis rectus abdominal muscles after delivery. 51% of the women cannot perform a Kegel, which were verbal cueing alone. After being told verbally, 50% of the women cannot perform Kegel. 25% perform the exercise in manner that promotes further dysfunction. Hence, as gynecologists, it is very, very important for us to reassure the patient that that with Kegel's exercise, she will feel better, and how to do the correct Kegels. It is our duty to teach her. 65% of the women experience sexual dysfunction 18 months postpartum, regardless of the method of delivery, and 21% of the women undergo vaginal deliveries and have levator ani avulsion. 29% of the women undergoing vaginal deliveries could have pubic bone injuries. 77% postpartum women have low back pain that interferes with sexual dysfunction. And vaginal deliveries are #1 risk for the pelvic organ prolapse. So it is our duty to explain all this to the patient and to elicit history about this. So we have to teach the patient to embrace the pleasures. We have to reassure her that sexual wellness is indeed possible, and we have to teach her the pelvic floor exercises, engaging in pelvic floor exercises that can help relax these muscles, mind-body connection, communication and exploration with the partner, which is very, very important for a sexual wellness. So to understand the sexual health, there are a lot of myths versus a fact. Douching after sex prevents pregnancy and STI. Very wrong. Douching is ineffective in preventing pregnancy or STIs, but it can actually be more damaging and can disrupt the natural vaginal flora and increase the infection risk. You can't get an STI from oral sex. No, wrong. STI can be transmitted through oral sex. HPV only affects women. HPV affects both men and women. It can cause genital warts and can lead to cervical canal or pharyngeal cancer. Even can have laryngeal or tracheal warts are very common in men as well as women. And pulling out is a reliable method of birth control. It's less effective because the pre-ejaculate fluid can also contain the sperm. Men can't get yeast infections. Men also can get yeast infections, typically of the genital area. And condoms are 100% safe in preventing STIs. Condom can reduce STI risk, but they aren't completely effective to prevent infections like herpes and HPV. So this particular pain that she gets, sex is initially painful because of the psychological causes, that is fear, stress, anxiety, or the physical causes, that is infection, lack of lubrication post-pregnancy, or trauma. So this body then tightens the vaginal muscles. Tightening makes the sex painful and penetration may not be possible. Then it further goes into erection. Body reacts by bracing to protect from pain, avoidance of intimacy and lack of desire to develop this pain. And then the body comes to associate sex with pain. And these patients, though they are actually, there is sexual wellness, they cannot embrace it and they have to be counseled for their sexual wellness. So the primary prevention is premarital education, healthcare provider assessment. They have to establish patient-provider relationship, primary care of the women's general health and sexual health, contraception, bleeding control, evaluation, treatment, and preconception screening. Pregnancy workup is very, very important part of the sexual wellness. So the sexual checklist is a regular STI testing, safe sex practices, open communication with the patient, self-care and mental health, and using protection at all times. This is very, very important. As a gynec provider, we have to convince our patients to use protection at all times. So the sexual health principles are consent, which is very, very important between the partners, non-exploitative way. It has to be in a very non-exploitative way. The women should not feel exploited. Protections from HIV, STIs and unwanted pregnancy, and the mutual consent, sharing everything. This is very, very important part of the sexual health principle. So reminder, sexual health is a fundamental aspect of your overall well-being. Prioritize it just as you would as any other aspect of your health. Sexual health is very, very important. So there are a lot of books which are available and which we can give it to our patients to read. I have listed them here. And there are also websites like advocatesforyouth.org, familydoctor.org, sexpositivefamilies.com, wherein our patients can get information that they are shy to ask. These are good websites from which they can get a lot of information. So I hope I have covered the entire sexual wellness for you. So thank you for a very patient hearing.
Requesting chairpersons kindly give inputs on this.
Madan, you can also give.
Yes, actually it was very fantastic talk, ma'am. Many things actually we have not listened up till now. We are only discussing the disorders and the management and not discussing about what is actually the wellness. You have highlighted very well. Very well. Congratulations, ma'am. And thank you for
Thank you.
highlighting these important things. What is actually wellness means.
Actually,
Yeah, I
I would
think.
add compact and crisp, madam. You took that good slides of vaginal discharge and especially the social theme, what it should orient when your sexual orientation is there. Excellent, madam.
Slides were excellent. Content was very nice.
I think my
Yes.
job has become very easy, Madan.
Yes, Dr. Geeta, it
So
was
then,
really a very practical, in very practical way you discussed everything. So it's, very difficult to explain in such a simple way. So brilliant job from your side.
Thank
Good.
you.
Slides were fantastic.
yes, Dr. Suhasini ma'am,
Thank you.
any comments?
I request you all to support me in this forthcoming election.
I would
Yes.
like to highlight that Geeta
Yes,
ma'am
Mrs.
is
Shul,
posting
ma'am.
small snippets and they are very useful. I've been going
Yeah.
through that and it's very concise and very nice, ma'am. Thank you for that, and I'm sharing it with my society as well.
Thank you, Archana.
Yeah, and they come very promptly at 6:15 in the morning.
Yes.
1 minute, 1 minute, and very much readable, and we send it with joy to our friends.
Ma'am, please share
Saudamini,
once
you're
again the link you are explaining, telling about the sexual health. Geeta ma'am, your talk is very well explanatory, and I just want you to repeat the links you were telling about.
Yes, ma'am. I will share this link
Hello.
on the group after completion of this webinar.
Yes, sir. Thank you.
Yeah, I'll share.
Thank you, Geeta ma'am. Your talk was indeed enlightening, very new aspects to know. And as Dr. Madan rightly said, sexual wellness is what we should really think upon. We were talking about only the illness. So thank you very much, ma'am. And we move on to our second session of today. We are having three beautiful chairpersons for the next session. Dr. Nibha Mohan, who is the secretary of she's a secretary of Patna Obstetric Gynec Society. She has various achievements to her CV. Welcome, ma'am. Nice meeting you. Our next chairperson for today is Dr. Rekha Rajendra Kumar. She is also having a very big CV right from her college days till yet. Welcome, ma'am.
Thank you.
Our third chairperson for today is Dr. Shiva Raut. She is a secretary of the Sevagram Obstetric Gynec Society. I welcome all three of you and request you to introduce our today's speaker. Thank you.
Okay, thank you so much. And thanks, Dr. Madan and the organizers for giving us this opportunity. It's really good to have us amongst you all, AMOX group. So to start the next session, we have another very brilliant speaker, Dr. Archana Dwivedi. I know her since since years. We have worked together with other society and other committee as well. So Dr. Archana, I know she's a very vibrant, intelligent and disciplined girl, I must say. And she is president at present Baroda Obs and Gynae Society. And she was also another session she had was president during 21-22 as well, and she has been active in Menopause Society as well, and in different field of FOGSI she has been working so hard for years. And currently she is chairperson of Midlife Management Committee FOGSI, and I know she is doing great. So welcome, Dr. Archana. She'll be presenting about midlife psychosexual crisis. So very important topic she's going to deal with. I think Dr. Rekha, our co-chairperson, is going to introduce that topic or after her talk.
Yeah. Dr. Archana,
So
just as
let her
prelim, yeah, thank you, Dr. Nibha. Dr. Archana, as
The prelude, you are the right person for the talk. Dr. Madan Kamble is very wise and witty in selecting you, the appropriate person, because you've been doing a lot of work in the midlife. And let us hear from you about the sexual aspect also, and let us add or discuss after you finish your presentation. Over to you.
It's a pleasure to be my dear friends, Dr. Rekha ma'am, Nibadi, and everybody else, Bhaskar sir and Rajendra Pardesi sir. And let me, before I start the talk, I said we all had in our homes, we have dinner set, we have sofa set, we have so many sets. Only thing was left was mindset. What the sexual committee is giving us, that we should have a mindset and a positive thinking when we talk about dealing with the sexual health. And I think Dr. Geeta has made my job very easy. Rekha ma'am, can you see my slides?
Yes.
Your CV is visible.
Your CV. Your first slide is your CV, I think.
So I'll just put it that way. Now it's moving for you. Can you see that?
Yeah, you're right. You're right.
So since the sexual committee has been very active, and I think if I talk about being sexy at 40, that would be the more appropriate title from my side, which I'll be discussing in few slides coming over. So midlife health, is it a psychosexual crisis or the necessity of today? Thank you for giving me this apt topic, because when the midlife approaches, say 35 and beyond, there's a transitional stage where you are neither adult, neither geriatric, neither a youngster, but it involves biological, physiological, social, and sexual changes. So there are challenges when it comes to identity, when it comes to intimacy, when it comes to the desires of your day-to-day activities. This all together, there's an Erikson psychosocial development of a person. As you can see over here in this chart, it's very beautifully seen that when the middle age comes, between 19 to 29 years, you are craving for love, establish intimacy and relationships. And as you approach the midlife or the middle age, that is 35 and around, you start becoming more caring. You have a wisdom. Or maybe if I say it's very hard to improve the perfection which you achieve by that time. So that is what is troubling when we talk about the psychological crisis, because there is stagnation versus generativity. There is crisis because you are feeling productive and you are feeling unfulfilled. There's a relevance. You're always correlating your self-worth, your relationship, and you're trying to understand where do you stand when in terms of sexuality. So all these things when go hand in hand, there's a biophysical model, which Madam already said, that it involves the biological changes of your physical health, the neurobiological, there's endocrinal change. There is a cultural, socio-cultural thing which surrounds us, in terms of different social taboos where the upbringing does matter. There are cultural norms and there are expectations of the family, the children, the mother-in-laws, father-in-laws, and other things where this all goes hand in hand. And I have to talk about it in terms of psychology, which reflects a person's personality as anxious, impaired self-image, a sort of depression, anhedonia, I would say. They want to be isolated for some time. They want their me time and re-evaluation, what we have done till now. Why are we not the same as before? There arises the interpersonal conflict, because the quality of current and past relationship do matter. The intervals of abstinence and life stresses, all these things contribute when I have to talk about the sexual health of a patient. So this model explains that physical functioning does affect the midlife. We are estrogen dependent, and this is no myth that estrogen causes most of the physical and the anatomical changes. The psychological well-being is also dependent on some of the hormonal interbalance. The social relationships where you are having a physical discomfort, a mental discomfort, trying to adjust, they are all having a negative impact when you talk about the sexual and interpersonal relationship between the partners. And to add on the icing of the cake, there is always economical stress, where the social stability becomes a question, access to the healthcare, and again the menopausal symptoms or the midlife performance which is getting suffered do plays an important part over here. So when I talk about the female sexual health, I think as the menopause stage, there is tiredness, there is joint pain, there is the hormones which are causing the mood swings, the mental health, the personality traits are there, low self-esteem is there, and the very important thing is that the social support, the relationship quality, maybe a hug or maybe just a sentence, I'm there for you, is lacking, because she is the one who's still doing, and the reflection of being available in a very sore manner. Why? Because she needs the comfort which is missing, because the partner is also not available at times, doing his or her daily chores. All these things matters. So here I would be addressing menopause and andropause together. Why male partner? Because mood swings occur there also. There is also depression, headaches are there, night sweats are there. They also have insomnia. There's a weight gain. Males also have that apple-shaped body. There's bone loss which is occurring in a subtle way there also. Females are forgetful, hot flashes, nausea, heart palpitations, irregular periods, dryness in vagina, joints, aches and pains. Whereas the male has got a decreased motivation, a decreased force because there's low energy. Libido loss is here also. Lack of focus is there. Muscle loss is there. Mild or moderate erectile dysfunction, and the muscle loss is very important. So if I have to label it this way, what is causing erectile dysfunction in a male person? He may be predisposed to the comorbid conditions like hypertension, diabetes, stress is there, smoking, his aging pattern, the spine pattern, cord damage, sometimes low testosterone levels and other medications which are affecting his health, and alcohol and other abuses also affect that. So men have got decreased testosterone, erectile changes, work stress and burnout, whereas women are trying to fight with the menopause and midlife changes, decreased libido and body image. Believe me, that is a very, very important aspect when I talk about a psychosexual crisis. And this gender difference, because male is always thought to have an upper hand, he's never thought in our society as a weak or a gender who's not able to do something, a superman in all categories. So the men do have performance anxiety, fear of aging, and the affairs, extramarital affairs of being attracted to different ladies when it is not coming, the expectations are not being met. And the women feel invisible. The role shift from the caregiver to an individual. There's an emptiness syndrome. She's all alone sudden, the loneliness syndrome I would call. So emotional intimacy often becomes very important, just the physical sex, because that is what is lacking and causing the crisis in the couple. So sexuality, the changing libido, physical intimacy needs, impact of aging, illness, medication, and the important thing is desire versus performance anxiety. And why does it arise? Because there's a communication gap between the partners. There's so many people in between who are playing parts, your job, people whom you have employed, the workers at home, your kids, their peer pressure, their problems, the geriatric mother and father to be taken care of. So all these things, you are so busy individually that the communication is lacking. And now this is the myth. No more a myth, it is a reality, because there is restlessness, there is infidelity, depression, identity confusion. Patients usually seek younger partners, cosmetic surgeries, they go after people. Drastic life changes have been observed in this case, not universal, but can be psychosexual in nature. These changes are there. So now talking about the concept of sexual health, which has been developed at 1975 conference of the World Health Organization, is currently being used to set up a nationally published public health programs in various countries. So the female sexuality is not only the important component of women's health, but also a basic human right. And it was defined as state of physical, emotional, mental, and social well-being related to sexuality, not merely the absence of dysfunction and infirmity, which has now revised in 1975, states that integration of somatic, emotional, intellectual, and social aspect of sexual being in ways that are positively enriching and that enhance the personality, communication, and love between the couple, which is very important. So if we have to redefine, the purpose of sexual health care should be enhancement of life and personal relationship, not merely counseling and care relation to procreation or sexually transmitted diseases. Because we are more worried about these things rather than having a notion on positive approach to the human sexuality. So global study of sexual attitudes and behavior, which includes almost more than 13,000 women above the age of 40 to 80 years, reported that almost 20 to 48% women do have lack of sexual interest, and almost 18 to 41% have difficulty achieving the orgasm. So they were like common female sexual dysfunction across the world region demonstrated significant impact on women's self-esteem and quality of life, and causes an emotional distress leading to the relationship problems. There are glitches. As a care provider, we have to understand that we are non-judgmental. We have to be non-judgmental. If a lady who's above 70 comes and says that she's sexually not satisfied, immediately thought props up, oh, she's still active. She still requires the treatment. Now, this is being judgmental. So the association of importance of sex with all domains of sexual function suggests that asking patients about the importance of sex may be a cornerstone of management of sexual concerns in midlife, rather than just being judgmental, because there are hormonal and non-hormonal, multifaceted things which a lady or a gent or a male person is dealing with. So clinician issues have to deal with the personal issues. There's a lack of training to the clinicians as well. We do lack skills sometimes. We do have lack of time because one person managing everything, and we have a silent fear of embarrassing our patient. And we have lack of treatments to offer to our patient in different case scenarios, and believe that sexual interest should decline with age. Here we have to redefine ourselves. Maybe we need to retreat ourselves, because there's a definitive overlap when we talk about the sexual desire disorders, sexual arousal disorder, orgasmic vaginismus, and dyspareunia. See, there are so many categories and they come as an overlap. So patient has to be digged out, silently heard, given a ear, so that we have a proper history, because she may be fighting with unfulfilled expectations. Whereas there's a typical urge to evaluate one's progress and set future goals may prompt this appraisal. So it might take you question if your actions matches your values. People may question if they are on track or veering off. These individuals do reflect their achievements, goals, and overall satisfaction in their life. If they not able to meet, there are unresolved issues where there may be trauma, the childhood trauma, disputes, unresolved difficulty. These concerns do impact the later on life, because the personal disappointments are there for everybody, and we need to understand it is that what is bothering her to have a normal sexual activity. So we have got these 7 points to talk. When we have a lady above 35, please talk, because she is suffering from midlife crisis. Psychological phase do marks a self-reflection and happiness in one's life. People may start having self-doubt, and they are not having a directional orientation of their thoughts. May also have anxiety, panic attacks, or maybe missed chances. They may make hasty choices like changing careers, changing the group, and they want to find their purpose back into life of being young again. Many things such as unresolved problems do affect them. They cause midlife crisis. And even though it can be hard, the times can also, they have a chance to learn more about themselves with a little help, and they can also grow through this psychosexual crisis. So I think we have a definitive correlation, what I've tried to prove in the previous slides. Now we'll talk about how to cope up with this type of crisis. First and the foremost part is open partner communication. It's always counseling for two, not for one. Hormone therapy, if indicated, counseling, sex therapy, mindfulness and self-compassion, and reconnecting with intimacy beyond sex. That is talking, foreplay, everything has to be told to them. So when I have to talk about the treatment approach, this is a logarithm which I would like to follow, is that the first line approach is address the modifiable factor. Non-pharmacological intervention, do give sexual education, involve the partner. But if the mild symptoms or contraindication to the hormonal therapy, think of non-hormonal therapy, psychological interventions, and they come as vaginal lubricants, laser therapy, pelvic floor therapy, dilators. Madam has described very nicely. Sex therapy and cognitive behavior therapy. They is no contraindication, moderate to severe symptoms, non-responsive to a non-hormonal therapy, give them local hormone therapy. It can be given beyond 55 as well. Pharmacological interventions can be given, local estrogen, intravaginal DHEA can be given, transdermal testosterone can be given, and off-label, some people do give central nervous system agents as well. Oral osmifene and oral CEE, conjugated estrogens, and benzodiazepine can be given where there is a moderate to severe dyspareunia not eligible for the local estrogens with precautions. So we have treatment modality categorized into two definitions. One is psychosocial therapy, another is giving medication. Now here I would like to say no shoe fits everyone. Everybody has got their individual sizes. So be individualized, taking account in the severity of the symptoms, the medical condition, potential adverse effects, and their personal preferences. You give a vaginal gel, but that is a difficult thing for her. Then you think of oral MHT. You can give transdermal. Now we have got spray. If a topical country like us, too sweating, the topical patches won't work. So we have to be very individualized in this. And the most important thing when we talk about talking therapy, long-term, Freud invented this term that talking therapy can make it more sorted, because a lady coming with too much of confusion, this psychosocial therapies interventions are excellent initial tools for addressing them, and using biomedical and psychosocial interventions can give you optimal outcome. However, one of the barriers of this type of approach is what is known as treatment resistance. So if I have to talk about the interventions, you should give the basic sexual education and counseling, give the physiotherapy approach and psychosexual interventions in form. Like if I have to talk about the basic sexual counsel, give it a part as a medical consultation. Provide the patient inform the sexuality in different life phases. The spectrum of human sexual behavior needs to be discussed. Her cultural background, like if she comes from a very rural background, where she hardly gets a private room to stay with the husband. She is whole day busy. So there is a communication of the partner which is suffering. So she needs to be given the clues where she can have an environment where they both can be into a talking intimacy before the actual intimacy. Cognitive therapy, behavior therapy, and psychodynamic therapy works toward overcoming the resistance to change, because they are into a set pattern. They don't want to leave that pattern, but they want a change. So behavior therapy can include exercises that can be conducted at home to reduce the anxiety, because every patient cannot come to you so frequently. Cognitive therapy is something which is very, very important for the mental health, whether it be menopause or andropause, because individual thoughts, feelings, and behavior. Here we have to encourage the patient to become aware of the irrational belief and dysfunctional thoughts. And we have to be a role model. They have to give in that situation, like somebody else with that situation would act differently. So this is what helps them to change their way to think and rational approach to the treatment. If I have to talk to the patient this way, that the Daily Tune says the prescription is very important, because the era still has not come when we have an option to change the husband or the husband replacement. So we have to go for the hormone replacement therapy on a lighter note. So if I have to talk about erectile dysfunction, this chart explains itself. Here, the team up with a urologist is a very important component, along with some psychosocial counseling, where can be androgen replacement therapy, phosphodiesterase inhibitors, like we all know sildenafil came with a bang and is here to stay. There are drugs, there are injections, there are surgical treatment, and there are device treatments also when there is an erectile dysfunction. Penile prosthesis implantations are available. So everything is cured. Only thing is we have to offer this basket to our patient, because with PRPs, the stem cell therapy, they are going to have a progressive treatment only. And maybe we are able to restore the endothelial dysfunction with the low intensity extracorporeal shock waves as well. Vacuum erectile device helps them, the penis, to be rehabilitated. Coming to the female, we have to offer hormonal strategies and the non-hormonal strategies. We all know estrogen, progesterone, and the local therapy. The SERMs are there. Non-hormonal, we have vaginal products, vaginal lasers, and vaginal suppositories. So if I have to categorize the medical options, we do have moisturizers and lubricants of various type, water-based, oil-based, silicone gel-based. We have estrogens, we have androgens, we have got DHEA, Tibolone, SERMs, And there are still newer agents and techniques which are developing and coming into the market. India is lacking behind, but sooner we are going to have all this in markets. This is a very important product, which is a non-hormonal product, which should be offered as a first-line therapy, because vaginal lubricants used prior to sexual activity will reduce the friction in the patient, and moisturizers, if they are used regularly, the lady tends to retain the moisture. So this is one thing which should be in the basket when we start with the prescription as a first-line therapy. Talking a little bit about the water-based gels used primarily for the vaginal dryness, dyspareunia, reducing lubrication. It is indicated whenever there is a vaginal atrophy, mild to moderate dyspareunia, and adjunct to the MHT where the MHT is. Refining this term hormone replacement therapy to menopause hormone therapy. Wherever it is contraindicated, we can give them as a first line of treatment. There was a very beautiful L-arginine gel which was available in the market. Suddenly, I don't find it anymore, but it is a very promising result. Outside, it is available as Nitrigia gel because it acts on the nitric oxide axis, peripheral vascular insufficiency, blood flow is increased, and this does help in sexual stimulation. This gel can be applied twice or once a daily, depending on the severity of the symptom. I had very good results when I was using this L-arginine, but unfortunately, Baroda, I don't have it anymore, but this was a very good option which was available. The clinical practice guidelines of Indian Menopausal Society says that if there is a recurrent attack of atrophic vaginitis, requires the use of smallest effective dose over a period of time. And after the control of acute symptoms, the dose of local estrogen can be tapered for long-term maintenance therapy. This can be continued indefinitely, although the safety data from studies not go beyond 1 year, but we have to judiciously use and call the patients for follow-up to see how they are improving, because recurrent urinary tract infection at this age, after ruling out other causes, may benefit the local. I can tell you with my experience, when you do a transvaginal sonography, there's a thinning of the anterior vaginal wall, there's loss of collagen, and once you are giving the estrogen therapy, you will definitely see in millimeters the changes appear after 3 monthly sonography if you give this drugs and see the results. So the patient is also happy that something is progressing and gives a extra psychological boost. We all know that MHT is a very important therapy we offer to our patient, because local vaginal estrogen for GSM, dryness, dyspareunia is a very good thing. Minimal systemic absorption is then. We don't need to monitor the endometrium with transvaginal sonography as well. Systemic estrogen do needs monitoring, and if there is a patient's uterus that is intact, we need to supplement progesterone, because we don't want breakthrough bleeding and unopposed growth of the endometrium. So this is the basket which I would like to offer you when I'm giving a patient our treatment. This is symptom profile, first line and second line. If there is only vaginal dryness, give non-hormonal moisturizers and lubricants. And second line therapy is local vaginal estrogen. Dyspareunia, if she's suffering, lubricants and moisturizers can be given in combination. And second line again, vaginal estrogen or DHEA. If she's suffering from GSM or vasomotor symptom, local estrogen and systemic MHT can be offered. Tibolone can be given as a second, or SERMs can also be given. Cancer survivor patients, non-hormonal options are better, especially when they are receptor positive. But vaginal estrogen can be given case by case with oncologist approval. Keep involving your team. That is going to help you with the medico-legal issues as well. So benefits, if I have to talk about the local system, is minimum systemic absorption, higher efficacy in restoring the vaginal epithelium. It also normalizes the pH and safe for most of the patients who are at high-risk patients. But we need to consult the oncologist when they are ARCP positive patients in terms of breast cancer. And typically, they don't need any monitoring or progesterone supplementation. You can follow this patient every 3 to 6 months. So if I have to choose combining, this is the right and wrong which I have given you. If she has got isolated vaginal dryness, painful sex, option of combining these three is there, but only hot flashes, bone loss prevention, mood changes, go for systemic MHT rather than giving the local. This is not going to be that effective, because when you give the systemic MHT, she's having proper sleep at night. Her body is not attached. She's not aching with pains, knee joint, the spine, everywhere. Her mood is elevated. I think sexual function is automatically going to improve. And indication according to the society guidelines of AACE, women less than 60 years or within 10 years of menopause, moderate to severe vasomotor symptoms, GSM may not be relieved by non-hormonal treatment, where MHT should be given as a first-line therapy. Only you have to rule out the unexplained vaginal bleeding, active thromboembolic disease, liver disease, or history of breast carcinoma, where you have to be very, very careful. Here, I would like to add one more important point, that obesity comes as a package with menopause. So MHT started at the right time will also be beneficial to prevent the centripetal obesity and help the patient in the sexual performance in a good way. So if I have to give subjective dryness, pH variation, rule out the infections, check for microbiota, evaluate the intimate products she has been using, more washes, more pH disturbances. Objective signs, rule out the pallor, rugae, and petechiae in the vagina, which will indirectly or directly tell you about the atrophic changes. And subjective dryness, if it is there, rule out other urogenital pathology, look for the other female sexual dysfunction, and also talk about the dyspareunia in these patients. This is the usual pH shift which we see as the lady from the childhood to the menopause. So this is a very important slide when I talk about the pH shift, becoming more alkaline, loss of Dodelin bacilli, less glycogen, so more protection, less protection, and suggest the vaginal atrophy. So if I have to, I think Madam talked it very nicely, but there are chronic conditions which need treatment like uterine prolapse, irritable bowel syndrome, back pain, hip pain. This all needs to be addressed properly. Chemotherapy, if she's undergone, surgical scarring is there. You can always offer them massage and relax stress tissue in the pelvic area, which can be helpful. And urogenital inflammation can be taken care with so many good drug advice available nowadays. Vaginal atrophy is very, very important thing. As I already discussed, you can give the vaginal inserts, the tubes and the jellies, and local moisturizers. This is a very important slide. I think the whole year I have been promoting the probiotics. I have used rampantly in many of patients, where it is giving very useful result when I have been talking about the vaginal atrophy and stimulating. Actually, when you're giving the intravaginal treatment for the infections of vaginal bacterial vaginosis or fungal infection, if you give this, the biofilm is not there, the approach to the vaginal antibiotic becomes more easier. So the capacity to colonize the gastrointestinal and vaginal milieu and foster the lactobacillus recolonization may provide a natural and efficient strategy for managing vaginal health during the menopause transition. Though further studies are there, we need to document it more, but definitely the benefits are there. If I have to give the vaginal hygiene tips to the patients, sex causes infections. So advice to urinate before and after the intercourse, flushed out toxins and prevents the bacteria from breeding near the urethra. So it is a very important step. Wipe labia majora minora from front to back. No hand should be brought from back to front. Wipe down the center of the meatus from front to back. Wash the inner thighs from proximal to distal. That way, you are going to avoid infection reaching to your sexual intimate area, henceforth giving you a better sexual life. Take bath morning and evening, and always wear neat, sun-bright cotton clothes undergarments. Do not use the same sanitary napkin for extended hours, preferably 4 to 6 hours. Do change. This can be framed and kept at your waiting area so the patient is aware automatically, because sometimes they don't want to talk about it. We all know diet modification is 80% of what I'm talking about. Nuts, rainbow plate, lots of salads, green leafy vegetables, and the berries which are available, black cohosh and all, we know they have got direct or indirect effect, which helps us into the sexual intimacy. Let me talk about cranberry extract and cranberry fruit. They have got definitive role in preventing the recurrent UTI in long-term use and helps our patients that way. Yoga, meditation, more mentally you are relaxed, the help reverses the heart disease, helps control you, the overthinking, increases the energy, reduces the stress. The best thing is there's an increased blood flow, a sense of calm and peaceness and balance in your life, which is going to automatically relieve the pain and enhance the body immune system. So you are benefiting from depression, anxiety, anger, and most of the common thing is confusion, because confusion is the mole root where the other things are going to pile up and add up and cause discomfort in the sexual life and the midlife crisis of this patient. Exercise for strength. Your pelvic muscles, your body needs these planks, these squats, the dumbbell lifting, because just walking won't be beneficial. You need to train your muscles for strength bearing exercise. For a proper sexual act, you need a good pelvic muscles. So that is a very, very important thing to take into account. A little word about the cosmetic aesthetic gynecology. Rejuvenation does matter. It gives you a self like uplifting, thodi to lift kara de wali feeling. And Botox indications, you know, I will not go just name it: vaginismus, dyspareunia after levotoplasty, vulvar vestibular syndrome, chronic pelvic pain, persistent arousal disorder. It definitely has got indications, but we have again to choose the patient rightly. Everybody is doing, so don't go and do it. You have to be rational, especially the things goes for PRP as well. It does improve your vulvar appearance. You have a designer vagina, improves your sexual life, tightens loose vagina, improves incontinence. I put a question mark because it's a long-term thing. It's not just a one-day therapy. So cosmetic gynecology may be a hype or hope for the patient individually, because this may benefit a set of patient, but may not be good for everybody. There are energy-based this fem chair or the pelvic chair, vibrator chair, though I think the cost is a little bit on the higher side, but those who have used it, they are getting benefited. Obviously, prolapse and other things, we do have a surgical options. The scope of services using the laser therapy, I think mid-age and geriatric practice, it is more beneficial in urinary incontinence when there is a POP or when there is a genito. Like GSM is there, vulvodynia is there, scar wart discoloration is there, bathroom cyst. I mean, clitoral reduction, vulvar aesthetics, recurrent vaginitis, labioplasty, vulval bleaching, all these things cause a feel of young age. Maybe it's helpful in some patients, not all. I would say I'm not here to advocate that, but these are the options which are available. So hype or hope, I don't know. Hope for and happiness for many. Proper training of the cosmetic or aesthetic gynecologist would make the difference. Cost effective, yet the life is changing, and so we are changing, because emotional health improves a lot after these think of the box treatment which are available. We doctors need to break the barrier. Mindsets are changing. Society's acceptance are better. It's an upcoming branch. So strengthening relationships with self. I mean, once you have a self-love, you become loving to everybody. So that is very important. Now, summarizing the tips I would like to give to my patients when they come into the OVID: avoid soaps altogether, avoid washes altogether. Front to back, we already discussed. Don't forget to dry them. Change the underwears frequently. Washing your vulva after urination is a must. Remember not to put a soap in vagina while bathing. No inside douching is required. The secretions itself would take care of it. Avoid douching. It cleans off the lactobacilli, good bacteria from your system. Exercise, nothing boosts your immunity and stamina as good exercise. Eat right. Regular health checkups are very important. Boost your libido. Perimenopause can sometimes form a dip. Talk to your partner. Find ways to reignite your intimacy. Here I would like to emphasize, when the lady is not able to cope up, she's shouting, she's banging, she's throwing things, tantrums. So straightforward lesson to all our patients we should give: write it down. Sit round table conference, sit with your family, talk about it. That gives you a better outcome, because you're talking concrete with them and they're going to understand what you're really suffering from, rather than howling around and roaming all over the house. So that helps you. Flaunt your grace, dear Alice. Create your own wonderland. Nobody's going to create it for you. This is the best psychosexual therapy for the midlife crisis. I do flaunt. I see Rekha every time. Rekha, madam, you're also there. Love you for that. But this Rekha is like amazing, you know, so many setbacks. Still, she outshines everybody once she's on the stage. So why not copy these people? And the take-home message is sexual health of women is an important overall health. The right procedure for the right patient by the right person for the right reason is going to stay, because FSD has got a great clinical suffering and it needs to be addressed properly. Apply topical estrogen on prescription. Continue having sex. More sexual activities like a thermal laser in your body, laser therapy. So that is what I tell our patient. Increase the frequency 3 times a week. That would help. Strengthen your pelvic floor. Stop into the abusing system. Apply substance abuse, vaginal moisturizer, use a lubricant. It's a good thing. So midlife is normal developmental stage, universal truth. For some, it may become psychosexual crosses, unmet emotional sexual needs, clash with changing roles and body. but for some it may be opportunity of growth, reinvention, and deeper intimacy. I think I'm interested in the third one to teach my patient and myself as well. And as I end my talk, I have got two beautiful ladies in this frame with myself, my mentors, Dr. Manju Verma ma'am, Dr. Meena Dayal ma'am. I've lost Dr. Dayal ma'am in COVID, but she stands still as an epitome of strength. I hope she's listening to me, because I leave you with great quote from Agatha: an archaeologist is the best husband a woman can have, because older she gets, more interested he's in her. So start sculpting your husband, good ladies out there, and be more sexually active and more be conscious about your psychosexual health, because it's going to help you. Thank you for the opportunity, because 40s may bring some drastic changes. However, these changes are not the ultimatum to a life that is declining. It signifies today is the right time to take charge of your well-being, take steps to improve your vaginal health, continue enjoying your healthy and promising life well into your happy state ever after. Thank you so much, Madan and team, and our society leaders over here. And it was, I'm nourished while I'm preparing this session. I think I was helpful, Madan, to your claims. And thank you, Nibha ma'am, and thank you, Rekha ma'am, for chairing my session. It's always good to see you, beautiful ladies. Shilpa ji, Suhashini ji. I think AMOGS is very close to my heart. And Kasoga, when you were there, Rekha ma'am. It's always a feeling of coming home to you guys. Thank you so much for the lovely support you had given to me in the last year. Yes,
Yeah,
ma'am.
thank you, Dr. Archana. Fantastic talk. You have covered everything. Probably there is no doubt in anybody's mind to ask. Had a PG student been there for your presentation, they would have largely benefited, and definitely the presentation will fetch them 100 out of 100 marks. That kind of presentation, it was fantastic. As you say, the woman in that period should learn to enjoy each moment of her life, as we all have been doing. Like you are in the webinar, you are enjoying your time. So exactly, because I feel it's midlife, and probably 40 to 50% of your life is gone, and how much ever remaining ahead of you, you're not very sure. This woman will be with a lot of confusion. Like she wants, in one side she wants me time, that she doesn't want anybody at that time, wants to enjoy herself. Husband has gone to work, children have gone to the colleges and all that. She's very happy, but at the same time sometimes she feels that she wants all of them together. So that kind of confusion is there. She doesn't know, when they're out she wants them, when they're in she wants them to go out. So that kind of situation. And physically also she has, as you said, lot of challenges other than the carcinoma problems or prolapses, the physical problems, even the non-gynec problems, as you mentioned, the bone problems, the many things, weight issues, whatever you have mentioned, sex problems like libido problem, the vaginal dryness. So she's ultimately suffering from lot of challenges, and the confusions are also so many. Balancing all this is very, very difficult for her, especially when they're not the gynec, our department, and not doctors. I mean, because cardiovascular problems may be there, so many tablets to take, economic challenges, depend on husband, financially not independent, and they are sometimes limited only to the kitchen work, not able to work, etc., etc. So it is our role as well as the role of the family to counsel them. When we counsel them, we have to bring husband in, we have to get a daughter-in-law and son, daughter, whoever is possible, we have to get them in and explain all the possible aspects to them. And the treatment part, of course, you have mentioned everything about the treatment. The aesthetic gynecology part, what you mentioned was right. Another important aspect which many of us have forgotten. And though aesthetic gynecology is taking a lot of fame and getting a lot of opportunity, especially in these women, and these are the ones who seek for it. And a very important thing what you said is we have to be non-judgmental, because she is in her shoes. She is the person who will decide about herself, and we can only support her, counsel her, and give empathy and empathize on her. Thank you so much for that brilliant presentation.
Thank you, ma'am. Coming from you, I'm feeling very elated. Thank you, Madan, for such a wonderful time with everybody. And as you said, confusion and empathy. We have to deal with confusion with empathy. Yes, Nibha,
Yes.
your word.
Yes, Archana, that was a really wonderful talk, and that the period and the topic which you have given and you spoke, I think this is the period when the woman are at their best, if they keep their health fit, if they are they have no comorbidities or less of them, this is the best period of them to enjoy. So let's them give the best sexual part of tips what we can give, so that there is no fear, they can enjoy their life their best. And the counseling part, the treatment part, the management part, and the exclusion of the disease, and they will have the wonderful life. So great, congratulations Archana for that. And thank you Madan and everyone for giving us this opportunity.
Dr. Shilpa. Dr. Shilpa.
Madam, one point I just to add, Shilpa madam, please excuse me, just only one point. Dr. Archana, I also feel that another thing that they should nurture their hobbies. Whatever hobbies they want to do, maybe it's a new thing. They might have stopped long before, say example, dancing and all that, they might have stopped much before, but they have to open that new chapter and enjoy and rejoice themselves. So many of their problems will go with that. Thank you. Sorry for interruption, Dr. Shilpa.
I'm very thankful for that point, madam, and best wishes to Rekha ma'am and Nibha ma'am, Madhuri Patel madam, and Geeta ma'am, because I'm seeing all the stalwarts already who are having a great knowledge and dedication towards society. And Madan, you are doing excellent. He is a dear friend. I meet him everywhere, but the hard work and the inputs he has been doing such a long time. I hope we are seeing in a near future in a new avatar to you, and hope you all the best in future endeavors.
Yeah.
Dr. Madan and
I will speak after the comment from third chairperson, Dr. Shilpa.
Yes.
Yes.
Thank you, Archana ma'am. Thank you for wonderful and elaborative talk. Actually, you address a subject that is often left unspoken with clarity and honesty. And I think you have the cherry on the top was you have covered the male midlife crisis very well. So thank you for enlightening us with your knowledge, ma'am. Thank you very much. And thank you, Madan sir, for inviting us. Thank you so much.
Thank you.
Well said, Dr. Shilpa. Perfectly said. Yeah.
Actually, it was very exhaustive and fantastic talk. The midlife is a period, actually, it is very crucial in the life of every woman. It is flooded with such duties and responsibilities. It is the second inning of life, what I suppose. And there are so many stresses, responsibilities of our husband, our career, financial, personal, social, everything. And every woman or couple has to go through it. And you have covered everything in detail. And thank you and congratulations.
We have to read.
Coming for the PG student was real, but to cherish, ma'am.
It was so comprehensive. You covered everything. I could not find anything that you haven't.
I think your committee is very fantastic. Midlife is covering everything. Very important committee.
Totally in that. Only thing is I have to find an archaeology husband. That's all.
Yeah. Or you have to teach him sculpting. Start teaching him. That would be very.
I know. Thank you, Madan sir, for giving us opportunity, as well as Dr. Saudamini. Thank you so much, madam. Thank you.
Thank you, everyone. Geeta ma'am also, Rekha ma'am, Nibha ma'am, and Madhuri ma'am also. Best wishes for your coming elections, for your great success.
Thank you.
Best wishes from AMOGS and everyone.
And best wishes to you too from us for your future endeavors.
Yes, thank you.
Thank you so much, Shilpa. Good to interact here, because most of the time we are talking on phone. We don't get to see each other quite often. So thank you, Madan, for giving this opportunity to us.
Yeah.
Yes,
I have listened to you first
there.
time actually.
With Shilpa and all, I've been talking and sharing my messages, but to see her, it's really good.
Thank you. Great evening ahead, Madan. Thank you for involving all of us.
I appeal all the presidents and secretaries of AMOGS societies to support our candidates who are working so hard and they deserve in proxy.
Thank you so much.
Official vote of thanks. On behalf of AMOGS Sexual Medicine Committee, I would like to extend my sincere thanks to AMOGS office bearers, Dr. Kiran Kurtkoti sir, Secretary Dr. Bipin Pandit sir, and the entire AMOGS family. My co-convener, my dear friend Dr. Saudamini. I also thank Chief Guest Dr. Bhaskar Pal sir, Pardeshi sir, Madhuri Patel ma'am, Parag sir, all the speakers and all the esteemed chairpersons of today's session. And I suppose it was a very successful and fantastic CME, full of knowledge was delivered. Yes, thank you. Thank you, Saudamini, for
Thank you,
coordinating.
Madan. Thank you all.
Thank you.
Thank you
Thank
so
you all
much.
the societies, all the presidents and secretaries
Yes.
for
Yes.
association with this event.
Requesting all of you to help us, support us, wish us, and bless us.
Our best wishes are always with all of you.
Thank
Uh,
you, madam.
so
I
much.
request all
Without
the
your support,
presidents,
it's difficult,
request
and
all
with
the
your
presidents
support, it's a bit
to
easy.
have maximum vote. Please look into that the maximum voting is done in the elections.
That is very important that we should vote actually. That is very valid point from Madan, because voting is our right and we should use it.
And
Thank you.
Right.
there comes the role of presidents and secretaries. They should do this job.
Yeah, exactly.
Their responsibility, right? You are.
Just take the follow whether everyone has voted or not.
Yeah, and one more thing, we did launch Smart Card by Dr. Sunita ma'am at Jaipur conference. So do like circulate the link you must have received in the mails. So once they enter that Smart Card, it's a good thing for their own identity, and automatic member verification would occur. So our voters would be having the right to vote, and maximum benefit to the election candidates. And it also gives a sense of worth that we are having our own Foxy card. So I think,
and they've done it much earlier so that they have enough time to see
Yeah.
where they stand and get them converted from B to A and all that.
It's just a fraction of seconds. It comes
Yes.
very automatically.
So Hasini madam, Shilpa madam, please support us before we close. Madan sir, thank you so much.
Yes, thank you once again for being with us. Thank you.
Thank you. Bye and good night.
Good night. Best wishes. Thank you.
Thank you.
Bye.